Presenting one of its kind, Dr. Haribhakti's Atlas of Robotic GI Surgery using SSI Mantra, a journey of precision innovation by the experts. Project initiated by Dr. Haribhakti, co-edited by Dr. Tushar Dave and Team Kaizen. Published by Haribhakti Education Foundation, supported by Kaizen Hospital and SS Innovations.
Welcome to the Mantra Insights video series. This video series is designed to help you with better understand and operate the Mantra surgical robot system. This video explains the potential functional halts that a user may encounter while operating the Mantra 3 robotic surgical system. Functional halts are broadly classified into 3 categories. Number 1, protective stop. Number 2, protective fault. And number 3, system standby. Protective stop is a safety mechanism intended to address unintentional handling deviations by the bedside team during manual arm operation. Protective stops may occur while moving the arm using the arm clutch, while inserting the instrument, when the arm is being docked, or during other manual arm operations. Only the arm being operated is affected with protective stop. Rest of the system remains unaffected. Indication: automatic disabling of the affected arm. A visual message is displayed on the SCC 2D screen, where the affected arm control displays a clear stop button highlighted in red. Recovery procedure: press the clear stop button on the SCC 2D control screen, or press the clear fault button on the SCC control panel. After clearing the stop, the arm must be enabled twice before resuming operation. Here are some important points to remember while the system is in protective stop. No need to undock the arm or remove the instruments. No need to restart or reset the system. No need to change arm configuration. Use red highlighted clear stop button on SCC 2D control screen or amber color clear fault button on SCC control panel to clear protective stop. Enable the affected arm twice post clearing the stop. In case of repeated protective stop occurrence, please contact our support teams for further assistance and resolution. Protective fault is a safety mechanism designed to address operational deviations while the surgeon is controlling the arm using the hand controllers. Protective fault may occur when the arm movement is mechanically restricted or any external force is applied on the arm while the arm is being operated with hand controller by the surgeon. Only the affected arm is impacted with protected fault, the rest of the system remains operational. Indication: automatic disabling of the affected arm. A visual message is displayed on the SCC 2D screen, where the affected arm control displays a clear fault button highlighted in amber. Recovery procedure: press the clear fault button on the SCC 2D control screen, or press the clear fault button on the SCC control panel. After clearing the fault, the arm must be enabled twice before operation. Here are some important points to remember while the system is in protective fault. No need to undock the arm or remove the instruments. No need to restart or reset the system. No need to change arm configuration. Use amber highlighted clear fault button on SCC 2D control screen or amber color clear fault button on SCC control panel to clear protective fault. Enable the affected arm twice post clearing the stop. In case of continued protective fault occurrence, please contact our tech support team for further assistance and resolution. Mantra surgical robot system consists of multiple communication cables internally as well as externally, which facilitates the communication between the components such as surgeon command center, vision cart, and patient side arm, as well as internal system components. If any of these communication cables are disconnected or disrupted, intentionally or unintentionally, the system may enter standby mode. In standby mode, the entire system is affected. Please note that when the system enters standby mode, the bedside team must ensure that all instruments are removed from the instrument arms and the endoscope is removed from the camera arm. If any arm is holding tissue, use the instrument grip release key to open the instrument jaws and safely release the tissue. Indication: automatic disabling of all arms. All arm controls on the SCC 2D screen are replaced with a standby message, followed by please restart system message on the screen after 30 seconds to 1 minute. When standby is encountered, users are advised to wait for up to 2 minutes. as the system may attempt automatic recovery. System standby is further classified into recoverable and non-recoverable standby. In recoverable standby, system communication is restored automatically and the "Please restart system" message disappears, followed by the normal operating screen on the SSI viewer with a clear fault button displayed on all arm controls. To recover, press the clear fault button for each arm on the SCC 2D screen, or press the clear fault button on the SCC control panel to clear faults on all arms simultaneously. After clearing the faults and before enabling the arms, ensure that no instrument or endoscope is mounted on the system. Enable each arm twice as instructed and allow the system to complete TI calibration before mounting any instrument or endoscope. Here are some important points to remember in case of recoverable standby. Ensure the instruments and endoscope is mounted from all arms. Wait for the system to recover automatically. Upon recovery, clear faults of all the robotic arms. Enable all the robotic arms twice. Ensure that TI calibration is completed before mounting the instruments and endoscope on robotic arm. In case the system cannot recover automatically, it may have encountered non-recoverable standby. Kindly follow the undocking sequence as stated. First, unmount all instruments and endoscope from the system. Second, undock all the arm from the patient trocar. Third, increase the boom column height of all patient side arm carts. Fourth, move all the cart back, removing it from patient area. Please note under standby condition the arms will be locked and cannot be moved either manually or by the controls. User need to undock arms and move the carts back under locked condition. In case the system fails to recover automatically after standby, kindly connect with our tech support team for further support and resolution.